To hand over to Dr. Jeevan Crasta at this stage, who's going to do a bit of a general session about vaccine hesitancy in our communities, I think. So thank you, Jeevan. The floor is yours. Thank you.
Thank you, Alison. Thank you. I'm just going to briefly sort of touch upon what the vaccine and what it means for our community. Now, there's clear evidence that COVID-19 does not affect all the population groups equally. Unfortunately, the risk of dying and serious infection is higher in certain groups such as 80 and older, males more affected than females, and the risk of serious infection and death is disproportionately higher in Black, Asian, minority and ethnic groups, or BAME groups, and also people living in deprived areas, and that's what the statistics have shown, and we are quite aware of this. Sadly, the uptake of vaccine has been much lower nationally in the same groups that are at the highest risk from what we've known. But looking at what Ian gave in terms of statistics, I'm quite pleased that we don't have that much of disparity within Cheshire as compared to the national statistics, but still we know that we need to spread the awareness to make sure that the vulnerable groups are vaccinated. And thankfully, getting the vaccine protects us and our community, regardless of faith, race, gender and sexual orientation, and therefore the effectivity of the vaccine doesn't rely on any of these parameters. So we should get vaccinated when it's our turn. Now, we've heard about how the vaccine actually protects us. Now, it's a protein derived from the virus, which is exposed to our body using the vaccine, and that stimulates our immune system to make antibodies and cells that fight against the COVID infection. What we need to be absolutely certain is that COVID-19 vaccines do not contain the live virus. So there is this concern that we may catch COVID from the vaccine, and that is completely unfounded because it doesn't contain a live virus. You may also have other concerns due to what is being said in social media and other similar platforms. There are enough of them to put us off vaccination. I would like to clarify some of these if I can. So all of the vaccines which are approved for use in the UK do not have any animal products or animal derivatives in them. I know this is of particular importance for members of certain faith groups, such as Muslims, Jews, and Hindus, who are concerned that the vaccine may have pork or beef, products or derivatives. I think not just faith groups, you also have our vegan and vegetarian, who have a vegan and vegetarian lifestyle, who would be concerned that there are animal products in the vaccine. So we have been reassured that none of these three vaccines approved so far and the others have any animal products in them. Now, vaccines also have been approved to be halal and kosher by the religious scholars of the respective communities. Okay, and the alcohol content is one of the concerns about it being kosher or not. And none of these, the alcohol content in any of these vaccines is no more than 1%. Okay, most of them have got less than 1%. And it's mainly used as a stabilizer. Now, to put this into perspective, this equates to the amount of alcohol that's present in most natural foods, or bread, for example. So that gives you a comparison of what this means. Our Muslim community is probably looking forward to Ramadan coming up in the less than 4 weeks, and they're concerned about vaccination while fasting. The British Muslim Association has said that it is okay to get vaccinated while fasting, and it's based on the principle that the vaccine is not administered orally. It is an intramuscular vaccine, as well as it's not considered as a food supplement, so it shouldn't be interfering with your fast. There's a wealth of information regarding this and much more on the website of British Islamic Medical Association, which I referred to in great detail yesterday to look up about this, and yeah, that's going to help. Now, some of the things that the NHS partners in Cheshire West are doing to help locally to support the different communities to take the vaccines. For example, the first example is what we're doing today. This webinar itself is aimed at that. The Race Equality Council have been talking to people from ethnic communities, as well as our community volunteers and the faith sector. We have lots of material pertaining to the vaccine that's available in different languages, so if you need. Also, the vaccination centres will try and accommodate your needs. For example, if you're forced, you will not be forced to book a vaccine on a special faith day, like Sabbath or any specific days. You can choose an appointment. And supporting vaccines during Ramadan, which I briefly touched upon earlier, we're working with the faith leaders to understand better the impact of, the vaccination and fasting. The vaccine sites can offer twilight appointments for those who do not wish to break their fast, so that the vaccine can be given as close to the hours of darkness as possible. Okay. We're also working to include and support other patients with other difficulties, such as learning difficulties, mental health issues. So to support patients, particularly from autism, who suffer from autism, the primary care networks and vaccine centres are working with the NHS partners to provide some useful resources, such as dedicated, easy-read specific guidelines. We also have care plans made to make reasonable adjustments, such as providing a quiet space, assisted experience. So some of the patients can be needle phobic, so you can be given numbing cream if you're aware of that beforehand. And staff are also given information toolkits to support patients with disabilities to make this vaccination process as comfortable as possible for them. We recognize that it's not the same for everybody going to a crowded place for a vaccination. There are also certain resources being developed such as autism-friendly videos and walkthroughs of COVID vaccination site, which should be available for use in the near future. We will continue to work with different sectors of the community to make sure that everybody can access this vaccination, and we urge you that when it's your turn, please get vaccinated. Thank you. Any questions?
Jeevan, that was great. Really, really helpful. Thank you for the effort you've put into pulling that together. So, I've learned a couple of things there about alcohol in bread. Didn't know that. I think one of the important things there where you were saying that for when we come to Ramadan, it's not an oral inject. You are injected into your arm, aren't you? You choose your right or left arm, depending on what's better for you. So that's a helpful pointer there. Thank you for the mentioning people with learning disabilities. It's been fantastic seeing the adjustments that vaccination centres are making. I know we've had some people, perhaps with autism, who want to come at the start or end of day when it's a bit quieter, and I've seen those adjustments being made, which is excellent. And you've talked about the walkthrough videos. We're going to get one, I think, for the race course, because that's a really important mass vaccination centre, because it really helps, doesn't it? We know what it's like going to a new place. It can be quite anxiety provoking, so to actually see what that's actually going to feel like, I think, is really important, and a number of our sites have already produced those videos, so really helpful. So thank you for covering that. Was a huge breadth of information there. So Katie, questions on that would be great. Thank you.
Thank you. I think, Dr. Crasta, you've covered most of the questions that have come through with your breadth of knowledge, as Alison's described. I think it might be, there's just a couple that may be worth reiterating some of the information. It asks here, or it's a question, some days are more important than others for my community. If I get invited for the vaccine on a Sabbath, can I genuinely request an alternative day?
Yes, the answer is yes. And the vaccination sites, the mass vaccination sites, both at racecourse as well as in the primary care network, are making allowances for this. But your GP is always there to support you in case you're not able to access. Please get in touch with your GP, because we are doing our best to support all our patients, in every way possible. So, thank you.
Thank you. And one more, which I think you have covered, but it asks if you put any specific plans in place for those who have disabilities to support them to feel more comfortable or to make the venues more appropriate and accessible when they go for their vaccine.
Yes, this has been a work that's been done right from the beginning, even before the mass vaccination site had been in place. Individual primary care networks have been finding either a venue within their GP practices to support small groups of patients with learning difficulties. But now that we're doing larger centres, as Alison said, there is a lot of work being done in the background to, with advice from the specific learning difficulties experts to make the reasonable adjustments that are required to support the patients with disabilities. Thank you.
Thank you. Has anybody got any other contributions on that one before I check whether Kate? I thought you might have, Ian. Brilliant. Thank you. Thank you, Ian.
Thank you, Jeevan. I was picking up on a couple of things there. So we had an outbreak board. Might have been this week, Alison, I'm not too sure, where similar came up about the numbing creams and what support can go into this. That's great to hear. I swear it was just an opportunity, really, just as an ask of people watching, if you're aware of any friends or family who do have learning disabilities, and double checking that they are registered with their local GPs to make sure that we can support them in many different ways, but also to make sure that they get that right access to the vaccination. You might have seen some communications that we've been promoting this week, but it's just maybe an ask from me to colleagues on who are watching this back to please encourage that wherever possible, really.
Thank you. And also just to check, and I think, Jeevan, you may have covered it, but just it sometimes helps to say it again. If you have autism or learning disabilities and you want to bring a carer with you, as long as I think they wear the appropriate mask, personal protective PPE, then that's perfectly okay, isn't it? I'm sure I've seen that. So just to confirm, Emily.
Absolutely, yeah. So we're making lots of adjustments actually to try and make sure that patients with learning disability can access the vaccine with as much calm and dignity as we can, and that includes some really basic things like absolutely bring your carer with you, someone that you feel really comfortable with, not queuing. We're asking patients, we're making sure, and we've got volunteers to make sure that anyone who's struggling with the queuing, actually, that we bring patients forward. We have a specific, much calmer, quieter area to deliver any vaccine for patients that might find the kind of the busyness of the normal kind of thoroughfare of the vaccination centre a little bit intimidating. So we're absolutely trying to make sure that patients that do have those increased needs are being cared for in the most appropriate way, so they can access the vaccine. Thank you.
Thanks, Emily. That was really helpful. Any more questions, Katie?
Nothing specifically around the area that Jeevan